Welcome to Leadership Rediscovered. This episode is a continuation of part 1 with David Goldberg. If you haven't had a chance to listen to that episode, please go back and listen before joining in on part 2. So one of the things that I always like to focus on in this podcast is just uncovering your leadership style and your definition of leadership, because I do think it's interesting, once you get past the fundamentals of what I would say is more management,
Yes.
to me, leadership becomes very much about your own individual approach to what you think a leader does, should do, and also your own values, behaviors, strengths, all of that. So I would love to hear anything that you could share on your individual definition of leadership, and then even describing your style of leadership.
I think leadership starts with authenticity, transparency, and character. You are constantly on stage. The minute I'm half of who I should be, someone else feels they can be half of who they need to be. I think you set the tone.
Yeah.
And it's a high standard
Yes.
to think about that. But if we are talking about masking, how do I not mask? If you remember the early days of the pandemic, I went to the football games when we opened them back up, and there I was with my face mask and the face shield in the crowd. It was important to set the tone of what we're saying we thought at the time we needed to do, and I need it. I have sideline passes as part of my donation to the Mountaineer Athletic Club. I was down there with my face mask on, my face shield, sweating like crazy when I'm down there. I'm not discrediting others who didn't.
No.
I felt it was important. I also believe I have to set the tone. I should not be managing the details day to day. I have a great team who do it, but I also want to be informed and educated about the why, so I could be educated if I'm asked a question like you asking me in an interview, or a board member, or the governor, or a U.S. or state senator or delegate. I need to know enough so I can explain it and make sure I'm comfortable with it. I don't run. We have an incident command, for example, through COVID. One of our chief nursing officers runs it for us, coordinates it. I have questions, but work through the structure to let them make the clinical decisions. I'm not clinical. I shouldn't be. I'm also, I believe, as a leader, you're a facilitator.
Yes.
You have to tell your why and listen. God gave us 2 ears and a mouth for a reason. I talk a lot. I move fast. But if I'm not taking time to absorb what you're saying, it's very easy to step over. And then you make, part of my language, you make your management team impotent to be able to execute. And that's something I don't want to do.
Right.
The other thing as a leader is connecting the dots consistently. When you're geographically distributed in your model and you have different issues at a local level, we could have a healthcare issue in Lewis County that's different than Preston County, that's different than Monongalia County. My job is to connect the people together to talk it through and not be exactly the same, but to bring consistency to drive out variation. And that was part of the couple years of me being here, is to integrate decision-making and groupthink. And I have a weekly meeting every Friday. We have Integration Friday, where all my senior leaders and I get together at 10 o'clock on Friday. And we go through, what are we doing to integrate this function? I have audience with you every Friday. This is what we're talking about with pay. This is what's happening down at our village at Heritage Point related to staffing. So we are not all just leaders of your entity. We are leaders of our healthcare system organization. We need to be vested in each other's success. And understand it. We get incentive compensation based on the organization's health, not one component. So all of our chief administrative officers are also senior vice presidents of Mon Health. So you're tied to everyone's mutual success. My chief administrative officers or administrators just started having their own meeting together. So they could talk. So some people said to me, well, how do you feel about that? Because some would be insecure. Well, are they gonna, is that Bash David time? If you're strong enough and comfortable enough and connected enough, they should have their own time to meet as a group. Because their day-to-day is so important for them to feel comfortable amongst themselves, to create the partnership, and I could facilitate. I do tend to want to fix things. So I'll see an email or whatever, and I'll try to jump in to fix it. And I've learned on a couple occasions, I don't take myself seriously, but boy, when I'm going 1 or 2 levels down, and asking a question or asking, some of them don't realize I'm trying to help, rather, oh my God, the CEO's calling me.
Yes.
And I have to remember
Yes.
that sometimes, even though I don't think I come across that way,
Right.
others is like,
Positionally, people pay attention
without
to
a
the
doubt.
position.
Or the email. I'm a big
Mhm.
believer in leadership. If you want me to react, you put me in the 2 line. If you want me just to be informed, you put me on the CC line. I don't want a world of emails responding back. After the 3rd email, stop and pick up the phone and
Pick up
call
the
somebody.
phone. Yes.
But keep me informed on what you need. When you need me and you put me in the 2 line, boy, I'm going to react.
Right.
I'm going to understand it because you're asking me to act. CC is courtesy copy. That's David, you're in the loop, or Melissa Lockwood at Preston, you're in the loop,
Just
or Karen
FYI.
Friggins, or Crystal, they're in it. I may pick up the phone and say, well, what do you mean by this email? But I get baited sometimes. We're human.
Right.
You want to jump in. And
Yeah.
I have to remember that's why I have great people to do their job. So I have plenty of flaws. And I try to set up from a leadership perspective, I never want to be the emperor wears no clothes. I want my team to be able to push back at me openly, candidly, and I'm okay with the debate, and I like the debate.
Yeah.
But when the decision is made, the decision is made.
Yeah. How do you set that tone, though? Because I think that's so important. And I see a lot of instances where we do get into that emperor's clothes situation where, leaders have a tendency sometimes to surround themselves with yes people, or maybe they say, I want people to challenge me, but their behavior doesn't match that and it shuts people down. So
I think the first thing,
what do you do to create
I remember my first meeting with the leadership team when I came into Mon in October of 2018, I said to the group, I said, who is your boss? And they all looked at me and they, well, you and nope, the board, the community. So first you have a responsibility that we are aligned, but I expect you to be candid and open. And if I make a decision that is contrary to our core values or puts us at risk or isn't explaining it, you have a responsibility to go to the board of directors to share your concern. And I'm here to tell you your job will be protected. I think you have to live that. And I've said that all along to my colleagues. If you interview any of them, hopefully they would continue to say, David says what he means what he says.
Yeah, and that's important.
You got to build the trust.
You have to build the trust.
Then after you build the trust, you have to not only trust, you have to deliver on it consistently. And that's why I led a couple minutes ago by saying to my people, what do you need from me? Yeah. I always end my conversation, what can I do for you? What more do you need? How can I help you? And huge. I think that's so important. And then you have to deliver on it. The words are words. It's the actual deliverable on it. What do you need me to do? Yeah, I'll get that meeting scheduled. Or yeah, that's a great point. Let's talk about that. Yeah. So I think that's a fundamental aspect in leadership that we get caught up on. And I get caught up like everybody else into trying to fix and execute. I'm a checklist guy. I'm an ENTJ. So I'm constantly trying to fix it, get it, move it on my list. But then I forget my list just passes it on to someone else's list that passes on to someone else's list.
Yes.
So let's be purposeful. I'm reading a book now on the American presidency, and it isn't about, I'm a history buff, but in it, it talks about the president of the United States rightfully can only address certain level of issues and trust the structures around it. And sometimes we forget. And the meaning of that book, and it makes me really remember, is not everything needs to be my decision or at my attention level.
Yes.
And I'm working really hard to push back what is something that should be at my level versus somebody else's. I may facilitate, but then I have to trust they're doing their part. So when I'm my one-on-ones, I keep my list and I'll say, I sent you an email on this. Where are we on that? Yeah. Not because I don't trust you're not doing it, but we talked about it. Are we on path?
Right.
Do you feel comfortable with it? Tell me where we are and do it. So I keep a list for everybody. And then when we have our one-on-ones or something comes up, I also try not to email after hours or at night. I save the email and then I'll send it out the next day, especially on late nights, which I don't sleep much, as you alluded to.
It doesn't seem like it.
And my mind is always going. I'm trying to get better to put it in there and hold it before I just respond or send it, because you know what happens when the email comes from your next level boss. I have to act on it right away. So I tell my people, I may send you a note. Doesn't mean I expect a response right away. Just respond. Timely. Timely doesn't mean in an hour. If I send you something when I'm going through my list of the day at 10 o'clock at night, that I expect you to respond at 10:02.
Yes.
It could be the next day or in a week. Just keep me informed.
Yeah.
But again, my work style, as my wife says to me, David, it's hard for people to keep up with you.
You're very high energy. Yeah.
And I talk fast and I act fast. and I talk as I process. And I say that a lot to people. I'm talking as I process. That's how
that's how
I
you
get it.
think. Yeah.
Some people, it took them a while to get used to my style. They thought I was making up my decision before the conversation.
Oh, how interesting.
And I said, nope, I'm talking as I process.
Yes.
I hear it now.
Yeah.
I got what you're saying.
Yeah.
Versus I said it and we're done.
Right.
And there's no more conversation.
Yeah. Oh, that's awesome. Anything that as you reflect on your career, things that maybe used to be leadership practices? I mean, you've talked about some things that you're working on right now, but any other things that you focus on differently now or have learned throughout your leadership journey that you feel like could be great tips to share with other leaders?
I think you have to triage the heightenedness, and I'm making up a word there, of the now versus what can wait. Not everything needs to be done right now. I want it off my list. Right. I want to know it's on. But again, there's other things people are doing that is as important in their span of control as what I think it is. So I'm trying to walk in the shoes of somebody else. I really work hard of thinking through what, if I send this note or we have this discussion, how is it going to land on you and how is it going to impact the way you lead your people or your area? So I'm trying to be conscious of that. The other is there's a lot of pressures on us right now in our industry, like with inflation, workforce demands, quality of care delivery. I could be in a manufacturing business. I could be selling houses. I could be running a restaurant. They're all consistent issues. It's the scope and scale of them might be a little different. So our push-pull has to be in the front of what we do. How do I keep people engaged? Yeah. We do an engagement survey, and I really read the comments. We had about 2,000 comments through our engagement survey, this last one, and I read every one and try to understand what was behind that particular comment and why they said it at the moment. Because when people do surveys at the very beginning, it's the people who are really engaged or the actively disengaged. Right. That respond correct. Yes. And then it's people in between. And I read it, and we held our own in many cases compared to 2 years ago with a pandemic, electronic health record conversion, financial, pressures on our industry. But the one that really upset me as the CEO, because I believe as a CEO, you're chief growth officer and you're chief storyteller. And I looked, and one of them was that people felt that strategic direction of the organization didn't excite them. And I look at it and say, look at all the things we're doing with ventures and growth and clinical programs. But there's people out there saying, I don't feel excited about where we're going. So now it's get back to the basics of this is why we're doing what we're doing. Yes. This is the why behind it. How do I get you to be energized or excited or part of the why that you own it? In marketing, there's advertising, there's direct mails, there's social media, but you can't forget what I call the B-52 campaign if I compare it to World War II. If you go back there, what were they doing so often in World War II? They were dropping leaflets. You have to be able to communicate the bigger picture, and then I need my sharpshooters to be laser focused on hitting the target. Yeah. And that is where I have to refocus with my team is this is the bigger picture, this is where we're going. Now I need my sharpshooters, which is the doctor building on their program or the OR nurse in there being top of their skill, or the phlebotomist or the physical therapist, the environmental service worker who mitigates spread of infection by keeping it clean, or the food service people who are delivering a medicine, which is nutrition. Yes. You all are part of the journey. You all have helped us become Leapfrog A or B or a 4-star CMS hospital or the 24th comprehensive heart care center in the country at Mount Health Medical Center. It wasn't the doctors who are extremely important and the cath lab nurse or the operating room nurse, but it was every other aspect of the healthcare journey, from the registrar to the greeter to the person who cleans your room to the person who delivers the care and the food. Yeah. And I think connecting that back for them is so important because you're right. I do think oftentimes leaders, especially, at your level, are in a very visionary, strategic type role. They're quite frequently looking, beyond, looking forward to try to think about what's next, where are we headed, how do we continue to grow, and then also balancing with that day-to-day piece. But to your point, sometimes I think when you set those visionary, strategic, what I think are inspirational and exciting goals for others, if maybe I am someone who's doing more of what I feel is a day in, day out, maybe I don't see that. I can't get that same vision that you do. And so I think it is so important that you take the time to communicate
Here's where we're going. Here's why. And oh, by the way, here's how you connect to that.
So on that, one of the things we did when we first got there is we reset our strategic plan in 2018, 2019. It was approved pretty quickly on a 3-year horizon. I think past that in healthcare is very difficult, not knowing what I didn't know.
In most organizations, it's hard.
But what do we do with a strategic plan? You do it, and sometimes you put it in the book, it's on the shelf, and you go on to your day-to-day. Ours is a placemat with tactics underneath it, and then we set goals and objectives for every one of our colleagues tied to the strategic plan. And then what we do is every month, each entity reports out on their aspect of the goals and objectives from the department to that level organization to the system. So use Stonewall Jackson Memorial. Here's your departmental goal. Here's your facility goal. Rolls up into our strategic plan. So we look at the Stonewall level, and then we roll it up into the system level, and we share that with the board.
Nice.
So they could see, here's what we said the tactics would be to hit top employer of choice, our vacancy rates, our retention rates, engagement scores, a host of other things, OSHA reportable, all of those things. Here it is, and here's how we're doing entity by entity.
That's awesome.
Then we do that from quality at each of our facilities, and then we have a system quality committee that looks holistically of the entire Mon Health organization. How are you doing on your door-to-doc time in your emergency room? How quick are people being admitted or discharged? What is your length of stay? What is your fall rate? All of that is transparent in front of the board, and I always say red is good. If you have red, that means it's opportunity. I don't want a softball goal.
Right.
I want to make sure that
Should
it's
be a
there
little bit of a stretch.
and have a just culture, that putting red up there is not a bad thing. It's what you do with it and how you fix it and how you hardwire your performance and your improvement. So it isn't people dependent, but it's people, process, technology. You can't just rely on one person. Does not constitute a program.
Yes.
That person can go. What happens if they leave? When they win the lottery that no one's winning right now? What do? You got to have a process in place for it that we are hardwired, remove the variability, and we have consistency. That is probably the root in any business, but in healthcare, lack of consistency can cause an error inadvertently. So we have to cross our T's and dot our I's. I have to continue to work to be more strategic than operational. In our system, we're lean. I'm pretty much CEO of our market, and I'm COO.
Okay.
And I slide in operations more than I want to be. So I purposely am working on the strategic side of it and work with our finance teams and our quality teams and the clinical teams to make sure they are supported to drive their part. So I can look at, where do we go next? Where is our data saying we have a gap in care that we could help that community? I don't just go somewhere to go somewhere. Like Marion had a gap when Fairmont closed their hospital. WVU Medicine stood up respectfully, so did we, and now we have 2 hospitals in a community at, I think, the right scale, because you're anchored by Morgantown and Harrison County for your higher level.
Right.
It reduced the overall cost of healthcare and improved access. Where else does that model work in our state and our region? We have an office in Hopwood, Pennsylvania. We have an outpatient office in Garrett County. We have offices in Elkins. Why in Elkins if you're from Morgantown? Because we had doctors going down there for decades. And we now are down in that community providing heart and vascular care with 8 other locations across north central West Virginia. We are 55 locations. As Vandalia, we're 200 locations across the state. That takes time and energy to focus on the who, the what, the where, the when, and the why.
Yes, and if you're so mired in the day-to-day operations, you don't have that time to be focused on the strategic piece as well.
And that's what a board should be, pushing us to be strategic. That's what I should be, to be the chief storyteller, the chief growth officer, the strategy officer. The good news is now I'm part of a larger group, and with Dave Ramsey as our CEO of Vandalia and our team, now we have a broader group to kind of look at. What decisions did we make in the past, and were they the right ones? And now with fresh eyes and emboldened and stronger capital resources, how do we use those resources? We don't call it the cost pillar, it's stewardship. How do we steward our resources to be responsible with what we do, people and dollars, not just the dollars, to make sure we don't overstretch and can't go back to our basics, which is top quality, top service, every patient, every time.
Well, and that's important because I think healthcare is under so much scrutiny from that financial perspective of where are these dollars going, who's getting what, how much profit is being made or lost, and just all around. I
Without
think
a doubt.
Patients want to know, insurance companies want to know, everybody wants to know.
And at the end of the day, a patient wants to be seen when they're sick. They don't want to have to wait. Now, we get dinged often. Oh, it took 2 weeks to get in to get my MRI. Well, did you know your insurance company, based on your plan, needs to authorize it, and it could take, by contract, 7 to 14 days for the insurance company time to authorize your elective MRI.
Right.
And then the
It's not us
hospital,
just sitting around.
yes, but we have to do a better job to advocate for our patients. If they're sick and they need the test, we need to get it in, but we also need to get paid for what we do.
Yeah.
Also, and it's a balancing act, or I can't get into that doctor right away. We have to do better in healthcare. It should not take 14 phone calls to get something done.
Yeah.
Healthcare gets caught up sometimes in the bureaucracy of creating structures. At the end of the day, I don't feel well, I want to see my doctor.
Right.
It could be by telemedicine or it can be in person, but we have to work to get you in timely. We have to work with our offices to be efficient. It doesn't mean get a patient through every 7 minutes, which I don't think is good care.
No.
But we do have to get them in timely and be stewards of our time to be able to make sure that when someone is vulnerable and sick, they choose us and they're seen by us and we're taking care of them personally. Dr. Brad Warden, who's our chief administrative officer of our medical group, and also our head of our cardiology practices all the time, warm touch, high technology.
Ooh,
That's the Mon difference.
Yeah, I like that. That's very cool. So another Mon difference, or something that I think is very interesting, if you'd be willing to spend a few minutes talking about it, is intermed, because I think that's such a cool concept and not super well known either.
So many of our doctors, engineers, healthcare professionals have great ideas. They don't always have a venue or a pathway to see if the idea is worth the next level of opportunity or not, or there's just not infrastructure in place to help you monetize, commercialize, kick the tires on an idea.
Yeah.
So a couple years ago, Dr. Tom McClellan, a very, very gifted, brilliant man, doctor in Monongalia County, and a friend, texted me on a Saturday, said, "You have a couple minutes?" Sure. So I picked up the phone, I called him back, and he said, "I have an idea. And we've been doing this little lab that's been validating different medical opportunities. And we've been looking at it probably the wrong way. We've been looking at much larger organizations to partner with." And he shared with me that he himself has developed some medical devices, and Mon Health Medical Center has been the backstop to use the MRI to test it, all appropriately, not on patients, but to test it.
Right.
What do you think about Mon partnering with us to create this, what we call an incubator studio, where a concept gets developed? We have engineering students from WVU and Penn State and others to kick the tires on it. And if it's worth something, maybe we make the product better and maybe sell. And again, down to our mission as a not-for-profit health system is, how do I improve the patient outcome? So if I can balance improving healthcare outcome and maybe create a device that monetizes, that we can then reinvest into our people, our technologies, our programs, win-win. And if we could be innovative, that's what excites a clinician.
Yeah, absolutely.
So we came up with it. Our board said, we love this idea. We invested in it. We gave them space in our medical park to be able to do it. And now we have dozens of MBA students, engineering students, and such working on products. We received a national award from an organization called ECRI that recognized a device for finger amputation that they developed out of this lab, which is in the final throes from the Plastic Surgery Society at the end of the month, is reviewing it as potentially a lead item in their particular academy.
Wow.
We created an eye protection group. It's called SNAPS, which my wife just had eye surgery, and you have to affix eye guards onto your eyes. Well, this snaps on, snaps off, rather than taping over your eye. We're creating that business, and we're going to be partnering with a local organization to help us package and manufacture right here from Morgantown.
Wow.
We have a couple other devices that are in final review by large medical device companies to buy them or invest in the right to be the sole owner of these, which gives us multi-million-dollar opportunity on some. And it's happening here with doctors in our community who came up with an idea, and this Intermed Labs kicked the tires on it to make them even better. And we have 8 or 10 different things right now working through deal flow or final review to create businesses right here, improve the patient experience in segments of industry that some of these large groups don't even have now. So they're buying something that could solve their problem from a business delivery of care, and it's coming right here from Morgantown, West Virginia.
That is such a cool story. And I love the entrepreneurial aspect to it, but also the fact that you're giving an avenue. You know, who better than clinicians who are doing this work day in and day out to say, "Oh, I've noticed a gap or a need. I think I know how to fill it, but I can't do it all on my own.
Well, I'll give you a
need some
great
help.
example. One of our lead urologists, Dr. Shakuri Rad here in Morgantown, has a particular issue with doing a procedure urologically. He came up with an idea. He serves on the board of Intermed with me. So I want, again, clinician led. And we meet, and he brought the idea to them. They've improved it multiple times. So and Dr. Shakuri Rad owns a part of the intellectual capital. It was his idea. Intermed owns a part of it, and Mon owns a part of Intermed. So from a financial, the doctor who came up with the idea, if it gets bought, big if, gets a piece of it, Intermed will get it, Mon will get it. And what we did is improve an outcome for patients, partnering maybe to bring this device out nationally, internationally, that could help tens of thousands of people, if not more. And it all started here in West Virginia.
Yeah. And I think it's so important that you're capturing that innovation, that if someone says, I have an idea, again, they have an avenue for that. Because I even think about how this translates into a corporate culture.
Absolutely.
For example, think about how many employees have phenomenal ideas and, whether they actually share those or not and where they go. I mean, I think there's a lot of variables and what plays into that. But I mean, the people who are doing that work day in and day out oftentimes know some of the best answers or the right answers of what to do.
When I was with Inova, we used to recognize people. We had a person who was able to save significant energy cost by tweaking something in the physical plan of one of our large hospitals. And it was an idea, it was presented, and he got a piece of the savings as a thank you. We do that at CAMC, and I hope to bring that up here to Mon, because people know where the waste is.
Yes.
But here in Intermed, people are really focused on improving the patient experience and the outcome. And if we could create an idea and then sell it, it isn't, it's about making some money to reinvest into our organizations. But if we can actually take scale and then offer that out on a broader, we just improved healthcare outcomes on a broader scale. That's exciting. That's one of the reasons I came here from my previous job, is the clinical aspect was so good and our doctors are so renowned and the Mon brand is so strong regionally. But now we have an opportunity to be a little bit more thought-provoking in an appropriate, balanced way. We are not a major academic institution. I know my skis.
Right.
I don't want to skate over my skis. I want to make sure we're balanced. At the end of the day, all these ideas are great, but if we don't have a bottom line to be able to maintain our sustainability, and that comes from excellent patient care and experience, then everything else is for naught. So it's, again, go back to your core of what you do.
Yes, great business lessons. Don't forget that core. Right?
And it's easy to get distracted.
For sure.
And right now, it's easy for me to get distracted solely on what efficiencies in the merger. I still have a business to run each and every day, and I have to empower my staff. I have to tell the why. I have to be positive, because I am. I'm very positive about the future, and I have to keep connecting the dots and keep looking at the next opportunity, but it has to be measured and valuable and balanced. You can't, my wife will tell you I want to do everything. I'm on all these boards. It's hard for me to ever say no. I had an organization come into me who's been for weeks trying to get on my schedule. I very rarely say no. I got a text this morning from someone, can I have an hour of your time? Yes. But sometimes you have, the strong no is as important as a weak yes.
Yes, I agree with that. And it's hard. It's hard to say no, especially when you want to help, you want to fix, you want to serve, that's great intentions. But you're right, there's always a cost that comes with it.
And then I look at it, my daughters who are now, my oldest is a senior in college and my youngest just started as a freshman in a different college. And sometimes I bounce ideas off of them. How does this land to you? Different generation. Everything is social media and such like that. And I watch my daughter, my senior daughter is the head of a large group at Ohio University. It's the programming committee. So all the events that they do for the students. And I watched her in the car one day as I was driving, and her phone is blowing up by text. And I said, what's going on? And she goes, oh, it's UPC and it's all these texts going on. And I said, so are you going to answer? She goes, nope. And I said, why? She goes, well, I told them I'm only checking my text at certain times of the day, and they have to work their structures, and the vice president of that is responsible for it, and I'll look into it later and then I'll respond later, but that's their job.
Well
and I went,
done.
And I said, you didn't learn that from me.
Great boundary setting.
But I said to her, I said, I learned something from you today.
Oh,
and I thought
cool.
that was really awesome. And then my youngest wants to be a theater director. So she's now doing this, and she's setting up her structure and she, what she can or can't do and boundaries. And I'm like, mom and dad didn't do half bad, but they observe so closely the good and the bad of what we do as role models, good or bad, and how the younger generation doesn't, in some cases, work the way we do. They work effectively with different approaches. And my message there is the unintended consequences of how you are coming across does percolate down.
Yes.
And when I saw that, I was like, ooh, really, really excellent.
That's fantastic.
Yeah.
And it's such a good reminder of just to circle back of what you were talking about much earlier in the conversation around just people are watching. You know, you're in such that visible role as a leader in a large organization, as a leader in the home, but so interesting to see the lessons that your daughters are picking up from you.
Many years ago when we lived in San Antonio, I was interviewing to come back to Pittsburgh, and I didn't really tell them at the time, but they knew San Antonio was a stop along the way. It wasn't going to be permanent. Wanted to get back to family into this area, my West Virginia Mountaineers football. And we were driving, and we have a rule in our family, don't ask the question unless you can handle the answer. We're driving on a side road, and Reagan turns to me and she goes, Dad, are we moving? So I went, why do you ask? She goes, well, you're traveling a lot. Your job's here. What's going on? So I said, I'm up for a job. First I said, our adage, don't ask the question unless you can handle the answer. I can handle it. And I said, yes, I've been offered a job. We're going to be moving. How do you feel about it? She goes, well, where are we going? And I said, well, we're going to Pittsburgh. And she's like, how far is that from Grammy and Pop-Pop? And I said, oh, to Virginia, about 4 hours. How about Grandma? New Jersey, about 6 hours. Okay.
Yeah.
Ask the question. How do you not do that with your employees? Don't ask the question unless you can handle the answer. And I really try not to put myself in a position as a leader to ask a question to people that I don't know a little bit of what I think you're going to say. I love when I don't, because I'm not the smartest person around. You surround yourself with great people. But lawyers don't put you on the stand usually unless they know what you're going to say.
Yes.
So my daughter is, don't ask the question unless you can handle the answer. And that's my adage with my team. You can ask me anything. I'll tell you, unless it's really confidential, but I will tell you what's going on and the why, but I need them to feel comfortable to push back and ask, well, okay, but have you thought about this and why? That it comes back down to authenticity, character, and transparency.
Yes. I think about that a lot too, because people will ask me my opinion on things, but they know that I'm very transparent, and sometimes I'm like, do you really want to know?
And sometimes they want you to validate it, or sometimes they just are checking the box. Well, I'll tell you, but I really don't care what you think. So you got to balance it. But again, if you trust your people and your people trust you, it should be that just culture. And I think that's the most fundamental part about building culture. Is transparency, character, authenticity.
Yep, absolutely. So as you think forward, and especially in terms of what's next, where do you see the ability for you to add the greatest value from a leadership perspective? What opportunities are out there for you?
Leadership is constant work. I think it's lots of reflection on yourself and surrounding yourself with more and more intelligent people than yourself. To be able to give them opportunity. I think as a leader, our job is to be like a coach. I'm looking to coach my successor. I'm looking to coach people up. I remember years ago, I was interviewing for a particular job at a hospital I was at in San Antonio, and they brought this person in to run the ICU. And I looked at the resume, and the person had perioperative experience, and I kept listening to her, and we had an opening in the OR. And I kept listening to what she was saying, and when the meeting was done, I kept asking her questions about the OR, and you could see her face. Why are you asking me about this? And she leaves. The team's there. I said, there's your next OR director. And then, no, ICU. And nope. Did you hear what she said about anesthesia? This. They offered her the job. She's now leading multiple hospitals' operating rooms with a very large health system in California.
Wow.
So our job as a leader is don't look right at today. You're looking at tomorrow.
Yeah. But you were also really listening.
I was,
too.
And it was, you looked at the resume. I don't like today's environment where resumes go in electronically and then people get sifted out. I think I could teach you the skill. I was a fundraiser. I was a not-for-profit person. I was taught by my foundational chief nurse at Loudoun, Joy Courier Salamita, Best mentor I think I've had next to Rod Hubers, John Paul, Cindy Hunderfeen at AHN, Dave Ramsey here. And I remember vividly him including me in meetings, Rod that was, and Joy, as the chief nurse, sitting me at her table when she was doing staffing and teaching me operations. I learned from that experience, and look at where I am today. So my job as a leader is find my next person, move people into slots, make them a little uncomfortable, but give them the background to be able to drive to the next level and invest in them. That's what we have to do as leaders. If you keep hiring the same people for the same role every time, you're going to keep getting what you always got.
Yes, absolutely. And no one's better for that in the organization.
Yes.
Including your patients or your customers or whoever your target is.
I learned the provider-led care team from the work Cindy Hunderfeen at Allegheny Health Network, who came from Cleveland Clinic, is doing. I believe no one's more important than the clinician in driving the decision. My part of it is I think you need to bring a strong administrative partner so you balance both aspects of the why, the clinical why to the business why, and come up with a mutual good decision. I joke I'm like the president of the Senate. I break the tie.
Yeah.
I shouldn't be making the clinical decision. I break the tie. The clinician is fundamentally responsible for the clinical decision and the outcome and the drive.
That's their expertise.
The other analogy, my daughter brought me in one time and said, Dad, what do you do? What is your job? And I said, when I was a vice president, I said, I'm like the vice principal. So she goes, oh, you deal with the bad kids. And I went, no, my job is to make sure the teacher is supported in the classroom, that the curriculum is consistent, you're safe as a student, resourced. Well, then when you became a CEO, what's your job? I'm like the principal. Well, so you deal with the bad kids? No. Now my job is to support the next level of leadership to make sure all of those things in the classroom are supported. A healthcare system is a little city. My job as the CEO or whatever title is to support all the people to do their jobs day in and day out, to take care of the patient, make sure it's a safe environment for you to give your skill and acumen to provide for your community's health and well-being, and also make sure we're fundamentally balanced financially, strategically, clinically, and I'll say outcomes driven to make sure we're in balance. That's why I said we have 6 pillars of success. I don't have one pillar, I have 6. You have to be in balance.
Yes, absolutely. But I love that you're looking across to really just create conditions for success in all aspects.
I hope. I always say hope is not a strategy, but I hope I am.
Yeah. Well, it's intent, though. You've got, good intent there. This has been such an impactful conversation. I know that I could keep going, but you're busy. So you have meetings to go to. I know that for sure. But anything we've left on the table we haven't gotten to talk about that you wanted to bring up today?
I think it's okay to say you don't know.
Yeah.
So many of us feel in leadership roles, the higher up you go, you can't admit you don't know or make a mistake. And I think it makes you a better leader to say I don't know or to listen and to ask. I also believe Todd Stottlemyre, who I work with at Inova many years ago, and I'm purposely mentioning these names so you see a theme of recognizing people who make you better than you all think you did it yourself. Todd told me a long time ago to create the kitchen cabinet of people along your journey that are not only in your industry but others. I was on the phone yesterday with the CEO of Select, David Chernow. He called me about an issue. I asked him some questions as he's running a multi-billion-dollar company. And I could pick up the phone and call someone like David, who's become a friend. I've been able, Senator Capito, Senator Manchin, have given cell phone numbers and love the opportunity to talk with them. Take advantage of the cabinet to bounce the ideas off of, because you're only as good as the great idea, but you're really only as good as the execution of your idea.
Absolutely.
So build your cabinet around you to make sure that you are not the emperor without clothes.
Yeah, those
and
people
balanced.
can help you with your blind spots.
Or give perspective I wouldn't think. How is this from a public policy? Brian Abraham, the chief of staff to the governor himself, Secretary Crouch, President Blair, Speaker Hanshaw, Leader Summers, Leader Takubo, and I'm Dr. Roba, Dr. Mahoney, Dr. Stallings, the county commissioners are fabulous people. They are who I believe are part of my customer base that I need to make sure of from a public policy perspective, no differently than the doctors. I meet every other month with a group of doctors at 6 a.m. Tell me what it's like to practice. This is what we're thinking about. Does this make sense or not? I'll end on this. You may have seen a couple months ago, there was an article that came out from Becker's that said some of the worst places to practice medicine, and one was Morgantown, West Virginia. Really hurt my feelings because I may not be born in West Virginia, but I'm a West Virginian by choice. And I was really upset by that article. I reached out, or I got called by the Dominion Post, David Beard, and he asked about it. And I said, why don't you come and ask the doctors yourself what it's like? I
Oh,
asked my
wow.
doctors. Again, I said a couple minutes ago, don't ask the question unless you know the answer.
Right.
Never give an open mic to a group of doctors in a room. But I said, David wants to interview. Will you make the time?
Yeah.
Not only did every doctor show up at 6 o'clock in the morning, and David did, but I had other doctors who are not on that committee who wanted to share. David asked them questions. It was a candid, open conversation. The
Wow.
doctor said, we could understand why in some respects it is, but not at Mon. That isn't our experience. And we were able to talk about it. And you can look in the Dominion Post and see Dr. Susan Capella, private urogyn community, Dr. Billy McBee, Dr. Chris Edwards, Dr. Joe Blatt, Dr. Kazi with oncology, Dr. Prettyman and Herring from women's. Cross-section of what it's like to be a doctor, and they love their experience, trials and tribulations and headwinds to be a doctor. But let the experts talk about the issues and give them audience to be able to share. And that clinically led approach, I think, is a fundamental opportunity in healthcare to give the clinician more of a voice, more of an opportunity. And we as the business people, if we call us that, is to balance it.
Yeah, but you're displaying a tremendous amount of trust in them.
They've earned it. Let's be honest, the doctors are here for generations. Administrators come and go. I don't want to go anywhere. Don't take my message differently from that. But they're the ones the patients are the doctors' patients.
Yes.
The hospital is a site of care along the journey.
Yes.
And the minute we start thinking they're our patients and not the doctor's patients, you have fundamentally, I think, missed the point of what we do in healthcare. The patient, physician, or nurse practitioner or physician's assistant interaction is fundamental. Patient listens to what the doctor says mostly, where to go, what to go, how to do it, what medicine to take, why I need this procedure. A hospital is a site along the journey to be the backup to the doctor to strengthen their brand of the why.
Right.
And when we start to take that away from them, you have fundamentally, I think, lost the opportunity to be a real, true community provider.
So good. Thank you for being
Thank
here.
you.
This has been amazing. Can we end with a lightning round?
Sure.
Oh, I'm so excited to hear your answers to these questions. Okay. 60 seconds to answer as many of these open-ended questions as you can.
Okay.
I'm going to set my timer. All right. What season best fits your personality?
Autumn.
Okay. What's your most used emoji in text?
The thumbs up.
All right. What book, song, movie, or podcast has had the greatest impact on your life?
Bob Iger's book that he did on leadership. Love it. I read it at least every quarter.
Is that Journey of a Lifetime or something like
that?
that?
The most recent one, yeah.
Okay. What's something about you that surprises people when they first hear it?
I'm probably not as confident as you think I am.
Very interesting. Fill in the blank. I spend too much money on...
Clothes, golf.
What celebrity would you want to play you in a movie?
I've been told by many people, even if it's not a celebrity, that Sanjay Gupta, the doctor, and I have a resemblance.
Interesting. All right. Best place you've traveled to?
Oh, boy. Ireland.
Ireland. That's beautiful there. First job?
First job out of college is I worked for the U.S. Senate.
Okay. What was your favorite subject in school?
Political science, American government.
That's awesome. Wow. Not that this is a competition, but I think you've answered the most questions of any guest.
Excellent.
Very well done. David, thank you again so much for
thank
being here. I'm excited.
Thanks for thinking of me.
Yeah.
I appreciate it.
Absolutely. Like I said, I think it's important for people to get to know you as a leader, and also an extension, of course, of Mon Health. But you spend a lot of time talking about Mon Health, which is great. But I think it's been
I think you could read the
great.
tone. But at the end of the day, I say this all the time. Great to get recognition in Mon Health, and I love what I do.
Yeah.
At the end of the day, it is my why is for my family. I do what I do so when people need care, I can be part of the continuum to provide health and well-being and hopefully reassurance of the why. That's why we do what we do, and it's calling to be in healthcare.
Yep, you're absolutely right. We can't forget that. Thank you.
Thank you very much.
All right, that's all the time we have today. Thanks so much for joining Leadership Rediscovered. Until next time, shine bright, everyone.